If you have been following the research on joint health, you already know that vitamin D matters for degenerative joint disease. We have covered that extensively on this channel. But there is another vitamin, one that almost nobody talks about in the context of joint health, that has research suggesting it may be even more directly relevant to the specific cellular processes driving cartilage degeneration than vitamin D itself. And I am willing to bet that you have never had anyone explain this connection to you clearly. That vitamin is vitamin K, specifically vitamin K2. And by the end of this video, you are going to understand exactly why this vitamin deserves a place in your degenerative joint disease management that very few sources have adequately explained. The specific mechanism that makes it uniquely relevant to cartilage and bone health simultaneously, what the actual research shows, and exactly how to use it correctly. Because vitamin K2 has specific interaction and dosing considerations that vitamin D simply does not carry, making correct usage genuinely more important to understand than with the vitamins we have covered previously on this channel. Before we begin, subscribe to this channel right now if you want this kind of deep, specific nutritional science for degenerative joint disease that goes beyond the vitamins everyone already knows about. We are committed to bringing you the complete picture, including the genuinely underexplored connections that deserve far more attention than they currently receive. Hit subscribe. Let us start with why vitamin K2 is relevant to degenerative joint disease at all. Because the connection is not obvious until you understand the specific protein systems this vitamin activates. Systems that turn out to be directly central to the calcification and mineralization processes that go wrong in degenerative joint disease in ways that are genuinely distinct from the vitamin D mechanisms we detailed previously, though complementary to them. Vitamin K functions as an essential cofactor for an enzyme called gamma-glutamyl carboxylase, which performs a specific chemical modification, carboxylation on a small number of specific proteins in the body, converting them from an inactive form into their biologically active form. Two of these vitamin K-dependent proteins are directly and specifically relevant to joint health: matrix GLA protein, abbreviated MGP, and osteocalcin. Matrix GLA protein, once activated through vitamin K-dependent carboxylation, functions as one of the body's primary inhibitors of pathological soft tissue calcification, meaning it actively prevents calcium from depositing inappropriately in tissues including blood vessels and, critically for our discussion today, cartilage. Osteocalcin, also activated through this same vitamin K-dependent carboxylation process, plays an essential role in directing calcium specifically into bone tissue, where it belongs, supporting healthy bone mineralization and density. Here is why this matters specifically for degenerative joint disease. Research has documented that one of the pathological features of advancing osteoarthritis is abnormal calcification occurring directly within the cartilage tissue itself, a process called chondrocalcinosis when it involves specific calcium crystal deposition that contributes to cartilage stiffness, altered mechanical properties, and accelerated degeneration through mechanisms distinct from but additive to the inflammatory and mechanical processes we have detailed extensively in our cartilage degeneration pathology video. Inadequately carboxylated and therefore inactive, matrix GLA protein has been specifically implicated in allowing this pathological cartilage calcification to occur, since without sufficient active MGP performing its calcification inhibiting function, calcium deposition within cartilage tissue proceeds without the molecular break that properly functioning MGP would otherwise provide. Research published in the journal Osteoarthritis and Cartilage has specifically documented that lower vitamin K status is associated with increased prevalence of cartilage and meniscal damage, increased likelihood of bone marrow lesions, and lower levels of carboxylated active matrix GLA protein, providing direct evidence connecting vitamin K status to the specific structural changes of degenerative joint disease through exactly the mechanism we have just described. A separate study examining vitamin K status and the osteoarthritis progression over time found that participants with vitamin K insufficiency showed significantly greater progression of structural disease markers compared to those with adequate vitamin K status, suggesting this is not simply a correlational finding but one with genuine perspective, time-ordered evidence supporting a meaningful relationship between vitamin K status and disease progression. This is genuinely distinct from the vitamin D mechanisms we detailed previously, which operate primarily through immune modulation and direct chondrocyte gene expression effects on inflammatory cytokine production, as we covered extensively in that earlier video. Vitamin K2's relevance operates through this specific calcification regulation pathway, meaning these two vitamins are working through complementary rather than redundant mechanisms, both relevant to joint health but through genuinely different molecular processes, which is part of why understanding vitamin K to specifically add something meaningfully new to your overall nutritional strategy, rather than simply duplicating what vitamin D already provides. Before we continue to the specific dosing and the critical interaction considerations that make vitamin K different from the supplements we have discussed previously, here is your pause. Had you heard of vitamin K2's connection to joint health before this video? Or is this entirely new information for you? Drop a comment below right now and tell us. This helps us understand how much of an information gap exists around this specific nutrient, which genuinely seems to be one of the most underexplained connections in joint health nutrition based on how this channel's community typically responds to topics we cover. Now let us address the specific forms of vitamin K, because this distinction matters significantly more for vitamin K than it does for most other vitamins we have discussed. And understanding it correctly is essential to actually getting the benefit this video is describing. Vitamin K exists in two primary forms relevant to human nutrition: vitamin K1, also called phylloquinone, found predominantly in green leafy vegetables, and vitamin K2, also called menaquinone, found in much smaller dietary quantities, predominantly in certain fermented foods and animal products, with the specific menaquinone subtype, MK7, found notably in the fermented soybean product natto, having received particular research attention for its superior bioavailability and substantially longer half-life in the bloodstream, compared to vitamin K1 or other menaquinone subtypes. This distinction matters because while vitamin K1 is plentiful in typical Western diets through green leafy vegetable consumption, and is the primary form responsible for the vitamin K-dependent clotting factor activation that most people associate with vitamin K if they know anything about it at all, vitamin K2, and specifically the MK7 subtype with its superior tissue distribution and extended half-life, appears to be specifically more relevant to the extrahepatic, meaning outside the liver, vitamin K-dependent protein activation, including the matrix GLA protein activation in cartilage, and the osteocalcin activation in bone that we have detailed as directly relevant to degenerative joint disease. Research has documented that vitamin K2, and MK7 specifically, reaches these peripheral tissues, including bone and cartilage, more effectively than vitamin K1, which tends to be preferentially utilized by the liver for its clotting factor activation function before peripheral tissues receive adequate supply, particularly in the doses typically obtained through diet alone. The practical implication for the specific cartilage and bone-related benefits we have detailed in this video, vitamin K2, specifically the MK7 form, taken as a targeted supplement, represents the most evidence-supported approach. Rather than simply assuming that eating green, leafy vegetables for vitamin K1 will adequately address the extrahepatic vitamin K-dependent protein activation that joint health specifically depends on. The research-supported dosing protocol for vitamin K2 MK7 specifically for joint health support is 100 to 200 micrograms daily, taken consistently, with research on matrix GLA protein carboxylation status suggesting that this dose range is generally sufficient to achieve meaningful improvement in carboxylation status over a period of several weeks to a few months of consistent supplementation. Though individual variation in baseline vitamin K status and the specific carboxylation needs of an individual's tissue can affect the precise dose required for any given person to achieve optimal carboxylation status. Now here is the critical interaction consideration that makes vitamin K genuinely different from every other supplement we have detailed throughout this entire channel, and that you absolutely need to understand before considering this supplement. Vitamin K directly and significantly interacts with warfarin, the blood-thinning medication, because warfarin works specifically by inhibiting the vitamin K-dependent activation of clotting factors, meaning that vitamin K supplementation can directly counteract warfarin's intended anticoagulant effect, potentially increasing clotting risk in patients taking this medication for legitimate medical reasons, including atrial fibrillation, mechanical heart valves, or history of blood clots. This is not a minor consideration to mention in passing the way we have noted milder potential interactions with some other supplements throughout this series. If you are taking warfarin specifically, you should not begin vitamin K supplementation without explicit physician guidance and almost certainly increased monitoring of your international normalized ratio, the blood test used to monitor warfarin's anticoagulant effect. Since introducing vitamin K supplementation will very likely require warfarin dose adjustment to maintain your anticoagulation within the therapeutic range your physician has determined is appropriate for your specific medical situation, This interaction is significant enough that it represents one of the few situations across this entire channel's supplement recommendations where we are specifically telling you that a particular supplement is not appropriate for self-directed use without direct physician involvement, rather than simply suggesting a conversation with your physician as a general best practice. For the newer direct oral anticoagulants, including apixaban, rivaroxaban, and similar medications that work through mechanisms not dependent on vitamin K activation of clotting factors, this specific interaction concern does not apply in the same way, though as with any supplement. Mentioning vitamin K to supplementation to your physician and pharmacist when reviewing your complete medication list remains appropriate practice regardless of which specific anticoagulant medication you may be taking. Beyond the warfarin interaction, vitamin K has a generally favorable safety profile, without the upper limit toxicity concerns that exist for fat-soluble vitamin D at very high doses, which we addressed in our previous vitamin D video, reflecting the different metabolic handling and storage characteristics of these two fat-soluble vitamins despite their shared fat solubility classification. The relationship between vitamin K2 and vitamin D specifically deserves direct discussion, because these two vitamins have been studied together with some research suggesting a synergistic relationship that makes combined supplementation potentially more valuable than either vitamin alone for bone and joint health specifically. Vitamin D promotes calcium absorption from the digestive tract and supports the chondrocyte gene expression effects we detailed in our previous video, while vitamin K2 ensures that calcium absorbed through this vitamin D-mediated process is directed appropriately into bone tissue through osteocalcin activation rather than depositing inappropriately in soft tissue including cartilage through the matrix GLA protein mechanism we detailed earlier in this video. This complementary relationship, where vitamin D increases calcium availability and vitamin K2 ensures that calcium is directed to its appropriate destination, represents a genuinely synergistic nutritional pairing rather than simply to separate vitamins that happen to both be relevant to bone and joint health independently. This synergistic relationship has specific research support, with studies examining combined vitamin D and vitamin K supplementation generally finding superior bone density outcomes compared to vitamin D supplementation alone, though the joint-specific research on this specific combination, as opposed to the more extensively studied bone density outcomes, remains somewhat more limited and represents an area where the existing single nutrient research we have detailed throughout this video provides stronger direct evidence than research specifically examining the combined supplementation approach for degenerative joint disease outcomes specifically. The dietary sources of vitamin K deserve mention for those who prefer obtaining nutrients through food where practical, though the practical reality is that achieving the supplemental dose range we have detailed through diet alone is genuinely difficult, given how concentrated dietary vitamin K sources actually are. Natto, the fermented soybean product traditional in Japanese cuisine, contains by far the highest vitamin K content of any commonly available food, though its distinctive taste and texture make it a food that many people outside cultures where it is traditionally consumed find genuinely difficult to incorporate regularly. Other fermented foods, including certain aged cheeses and other fermented dairy products, contain meaningful but substantially lower vitamin K content than natto, generally insufficient to reach the supplemental dose range we have detailed through diet alone without unrealistic quantities of these specific foods. For most adults seeking the specific dose range this video has detailed for joint health support, a targeted vitamin K MK7 supplement represents a more practical and more reliably dosed approach than attempting to achieve adequate intake through the limited dietary sources available. Similar to the practical reality we noted regarding vitamin D supplementation in our earlier video on that topic, the broader vitamin K2 and inflammation connection deserves additional exploration beyond the calcification-specific mechanism we have detailed, because emerging research suggests vitamin K may have relevance to degenerative joint disease through a second pathway operating somewhat independently of the matrix GLA protein and osteocalcin activation we have focused on so far. Research has documented that vitamin K has direct anti-inflammatory effects through inhibition of NF-κB signaling, the same master inflammatory transcription factor pathway we have discussed extensively throughout this entire arthritis series is central to the inflammatory cytokine production that drives cartilage degradation and joint pain. This NF-κB inhibitory effect appears to operate through a mechanism at least partially independent of vitamin K2's role as a cofactor for gamma-glutamyl carboxylase, suggesting that vitamin K2 may provide a dual benefit for degenerative joint disease the calcification regulation benefit through matrix GLA protein activation that we detailed as the primary mechanism this video has focused on, and an additional, mechanistically distinct anti-inflammatory benefit operating through direct NF-κB pathway modulation. Similar in target though through a different specific molecular mechanism to the NF-κB inhibitory effects we have described for curcumin in previous videos throughout this series. This dual mechanism, while research on the anti-inflammatory pathway specifically remains less extensively studied in the context of degenerative joint disease compared to the calcification regulation research we detail as the primary evidence base for this video, provides additional biological plausibility for why vitamin K deserves serious consideration as part of a comprehensive nutritional approach to degenerative joint disease, rather than the calcification regulation mechanism representing the sole pathway through which this vitamin might provide benefit. The question of how vitamin K fits into the complete comprehensive nutritional protocol we have built throughout this entire channel deserves explicit integration. The complete daily nutritional protocol for degenerative joint disease, now incorporating vitamin K alongside the previously detailed components, includes vitamin D3 at the 2000 to 4000 international unit range we detailed previously, taken with a vitamin K2M/K7 supplement at the 100 to 200 microgram dose we have detailed in this video, ideally taken together given their synergistic relationship in directing calcium appropriately. Omega-3 fatty acids at 2 4 grams of combined EPA and DHA daily for their distinct anti-inflammatory mechanism through specialized pro-resolving mediator production. Curcumin with piperine for its NF-κB inhibitory transcriptional effect, which we now understand vitamin K may complement through its own independent NF-κB modulation pathway. And magnesium glycinate for its role in pain modulation and its own contribution to the broader anti-inflammatory nutritional foundation this comprehensive protocol provides. This integration matters because no single nutrient, including the vitamin K we have detailed throughout this video despite its genuinely compelling and underexplored mechanism, represents a complete solution to degenerative joint disease on its own. The research-supported approach remains the comprehensive combination of appropriate nutritional support across multiple complementary mechanisms, the structured exercise program, the anti-inflammatory dietary pattern, and the appropriate pharmacological and procedural interventions when needed, all working together rather than any single component however compelling its individual mechanism, functioning as a standalone solution. For adults who have been following the comprehensive nutritional protocol this channel has detailed across previous videos and who are now considering adding vitamin K specifically based on the information in this video, the practical sequencing recommendation is straightforward. If you are not currently taking warfarin and have confirmed this directly given the critical importance of this interaction consideration we detailed earlier in this video, adding vitamin K2M/K7 at the dose range we have specified, ideally taken alongside your existing vitamin D supplementation given their synergistic relationship, represents a reasonable evidence-supported addition to your existing comprehensive nutritional protocol, implemented with the same several-week to several-month timeline for meaningful biological effect that we have emphasized throughout this entire channel applies to nutritional interventions generally. The specific quality and sourcing considerations for vitamin K supplements deserve attention, because this is an area where significant variation in product quality and labeling accuracy has been documented, making informed purchasing decisions genuinely more important than with some of the more standardized supplements we have detailed in previous videos throughout this series. Vitamin K2M/K7 supplements are available in two distinct molecular configurations, the trans and cis isomers, with research specifically documenting that only the trans configuration provides the biological activity relevant to the carboxylation mechanisms we have detailed throughout this video, while the cis configuration, which can result from inadequate manufacturing processes or improper storage conditions leading to degradation, provides little to no meaningful biological activity despite still registering on standard product labeling as containing vitamin K2M/K7. This means that to products both labeled as containing identical milligram amounts of vitamin K2M/K7 may provide meaningfully different actual biological activity depending on what proportion of their content exists in the active trans configuration versus the inactive cis configuration, a quality consideration that standard supplement labeling does not typically disclose. For consumers seeking to maximize the likelihood of receiving genuinely biologically active vitamin K2M/K7, looking specifically for products that reference third-party testing for trans isomer content or that use specifically named well-documented commercial vitamin K2 ingredients with established manufacturing quality control for trans-isomer purity, represents a more reliable approach than selecting based on labeled dose alone, since the labeled microgram amount provides no direct information about what proportion of that labeled content is actually present in the biologically active configuration. This video has detailed as necessary for the cartilage and bone benefits we have described. The timing of vitamin K2 supplementation relative to meals also deserves brief mention, since vitamin K2, as a fat-soluble vitamin, requires the presence of dietary fat for optimal absorption. Similar to the fat-soluble vitamin D, we detailed in our previous video on that nutrient. Taking vitamin K2 supplementation alongside a meal containing at least a modest amount of dietary fat, rather than on a completely empty stomach, supports more complete absorption of this fat-soluble nutrient. A simple practical consideration that meaningfully affects the actual bioavailability of whatever dose you are taking regardless of the specific product quality considerations we just detailed. This is the complete picture of vitamin K2 and degenerative joint disease, a genuinely underexplored nutrient with a specific, well-documented mechanism directly relevant to the pathological cartilage calcification that contributes to disease progression. Research evidence connecting vitamin K status to structural disease markers and progression, a specific recommended form and dose, a critically important interaction consideration that distinguishes this supplement from others we have covered, and a complementary relationship with vitamin D that potentially makes combined supplementation more valuable than either nutrient used alone. The historical context of why vitamin K2's relevance to bone and joint health has remained so underexplored compared to vitamin D deserves brief explanation, because understanding this history helps explain why you are likely hearing about this connection for the first time, despite the genuinely compelling research evidence we have detailed throughout this video. Vitamin K research historically focused almost exclusively on vitamin K1 and its well-established role in blood clotting, since this was the function discovered first, historically, and the function with the most immediate and dramatic clinical consequences when severely deficient, given the bleeding risk that significant vitamin K deficiency produces. This historical focus on the clotting function meant that research investment, clinical attention, and ultimately public health messaging about vitamin K concentrated heavily on ensuring adequate vitamin K1 intake for clotting factor function, a goal that typical Western dietary patterns generally achieve adequately through routine vegetable consumption, leaving comparatively little research attention directed toward vitamin K2 specifically and its distinct extra-hepatic functions in bone and cartilage tissue that this video has detailed. This research and attention gap has only begun closing in recent decades, as the specific roles of matrix GLA protein and osteocalcin, and the specific advantages of vitamin K2 over K1 for activating these particular proteins in peripheral tissue, have become better characterized through the kind of detailed molecular and clinical research we have referenced throughout this video. This relatively recent emergence of vitamin K2 specific research, compared to the much longer established vitamin D research base we detailed in our earlier video on that nutrient, partially explains why vitamin K2 remains comparatively underexplored in general health messaging despite the compelling mechanistic and clinical evidence this video has detailed, representing a genuine knowledge gap that thorough, evidence-based health content like this video aims specifically to help close. This video has given you information that sits at the genuine frontier of underexplored joint health nutrition, a specific vitamin, a specific mechanism, specific dosing, and quality guidance. A critical safety consideration that distinguishes this supplement from others, and the complete integration of this nutrient into the comprehensive management approach this entire channel has built. Use this information specifically, carefully regarding the warfarin interaction if relevant to your situation, and as one genuinely valuable component within the complete, evidence-based approach to degenerative joint disease that you deserve. If this video gave you a genuinely new piece of the nutritional puzzle for managing degenerative joint disease, one that very few sources have explained with this level of mechanistic detail, please support this channel. Hit the like button right now. Subscribe if you have not already, because we are committed to bringing you exactly this kind of underexplored evidence-based nutritional science. Share this video with someone managing degenerative joint disease who has never heard this specific connection explained. And leave a comment below. Tell us whether you are taking warfarin, which changes how you should approach this specific supplement, and whether vitamin K2 is something you are now going to discuss with your physician. We read every comment. Thank you so much for watching. See you in the next one.